But it is one that can easily parasitize the skin and cause a lot of issues for our dogs.
How do they get it?
It can be on the head, it could be on the nose, the ears, the belly.
Does it generally stay in one spot, or can it spread all around the dog?
I will definitely recommend these tests.
Ringworm. Is ringworm a worm? That's the biggest question we always get.
It's pretty much the only important one for the evening. Yeah, it's a great question because it really is a misnomer. But to answer it, ringworm is not a worm. It's not going to be any of the, tiny little rice-like worms that you may find, like tapeworms or roundworm. It's not an intestinal parasite, but it is one that can easily parasitize the skin and cause a lot of issues for our dogs. The technical name that we learn in vet school, the official name is dermatophytosis. And it's caused by a tiny little fungus from a couple different genera. So Microsporum is kind of the big one. Trichophyton is another one. And then rarely Epidermophyton, which is a huge mouthful. Most often I've really seen it, the Microsporum, like M. canis or Trichophyton. Those are the ones that kind of we get the fungal cultures back, and they may show those species.
Yeah, I think I had a friend in college that used to drive a Tricon back in Microtricon.
A Microtricon. Yeah. But yeah, I mean, speaking of epidermis, it is really a disease of the superficial skin and hair, and if we're dealing with birds, feathers or horns, claws, it could affect humans as well. We can get to the zoonotic potential there, but nails of us, of our skin, nails of our furry friends. But it's really going to be digesting the keratin in our skin, and with some enzymes that can kind of digest it and destroy it. And it is quite, unlike, parvo, which we spoke about in the first session, it's not life-threatening. Sometimes it's not even itchy, it's not causing any pruritus for our dogs, but it is very contagious and it spreads everywhere. It's like very hardy in the environment. It could last for years, and it's very difficult to get rid of. So there are a lot of,
How do they get it?
Of it. How do dogs get it?
Yeah.
Great question. So they get it from just living their lives. It could be out in the soil. So a lot of them are what would be called geophilic. So they really like to live in soil. So, if Lily's outdoors, digging up a pile of whatever she's trying to find or burying a bone. My dog Daisy back in New Orleans, she just goes nuts outside and just kicks up dirt and buries stuff and tries to go build. One time we caught her scratching the grass, creating a little bit of a hole to go underneath the fence to our neighbor's yard.
Of course,
we caught her, so she didn't make it. But anyway, a lot of these species love the soil. They're geophilic. Some are zoophilic, so they're living on animal skin. And, my dog may get it from our neighbor's dog if they come into contact with each other. So it's really direct contact with an animal or human or fomite, non-living thing on which the organism is on the surface. And so it would get on the hair and skin, and really what's necessary, it's not generally going to be affecting healthy skin. It's largely a disease if there's like a little scrape or some sort of defect or wound that it can kind of infiltrate. That's where it's going to set up shop and start asexually reproducing and then growing, and they can grow. Yeah.
Okay. What does it look like?
So the ringworm, that's like, the common name that we have for it. It's kind of that hallmark circle lesion that is red and inflamed, and there's usually a bunch of hair loss, because we can discuss kind of how the fungus attacks the hair follicle.
Sure.
But you're usually going to see a lot of scaling and alopecia, sometimes like urticaria or hives. But it's really kind of a hallmark lesion where you see, it's hard for me to describe without like showing a picture of it, but that's like the typical.
Paint a picture
lesion.
With your words.
Exactly. Yeah. It's not all. It's once again, it's a little bit of a misnomer, because you don't always see that typical red ring on dog skin. I've definitely seen it before, but ringworm really can present in a lot of different ways. So sometimes you just see the hair loss. Sometimes you just see scaly skin. Sometimes you see a little patch here, 2 centimeters, up or down the body. You may see more. It can be on the head. It could be on the nose, the ears, the belly, really just about anywhere. It can set up shop. And, it can start off kind of a small little patch and then grow and become pretty irregularly shaped. But that's usually, it comes in many different flavors.
Does it generally stay in one spot, or can it spread all around the dog?
It can spread all around the dog, and it can spread to the other dogs you have in the house or the cats you have in the house. So it depends. I don't know if there's a difference between, each individual species, like M. canis versus the Trichophyton, but it definitely Trichophyton. It definitely.
I think he wrecked it one time. Yeah, no.
Yeah.
So what does it? You mentioned, what does it do to the hair, like the keratin and things like? Talk about a little more in depth.
Yeah. So it has these cool for somebody studying microbial pathogenesis or interested in microbiology. It has these cool like keratinase enzymes, which will kind of attach to the hair follicle, and the mycelium, which is kind of one of the functional units of the fungus, will fragment into these little conidia, which has the spores of the fungus around the hair follicle, which may cause that hair shaft to break. And that's why one of the main things that we see is alopecia, the hair loss. And yeah, so that's kind of one of the main ways it goes about doing its business.
So when you have a dog come in, other than the obvious, you see the lesion on the dog, how would you guys diagnose?
Yeah, so definitely, while the gold standard, which we use in vet school, is not just visual observation, definitely important to distinguish potentially, suspect ringworm from other differential diagnoses, so other things that it could be, bacterial infection, for example, like, pyoderma can present kind of similarly. Some of the best tools that we have would be culturing the organism, and there are multiple ways of doing that. I always, if I have a suspicion based on, other pets in the house who may have similar lesions, or if an owner says, my dog has this, and, by the way, I also noticed some redness on my skin and whatnot, any historical findings, I will definitely recommend these tests. And, for unfortunately or fortunately, owners don't always opt to pursue the diagnostic tests. So I'm sure there's a lot of patients that I'll be treating, but it really goes underdiagnosed because we don't, I guess it's, one of the subpar things about veterinary medicine is, most people don't have insurance for their pets. It's
Right.
out of pocket, and if they don't want to, purchase, which can be quite an expensive fungal culture, then we may not know. There are other things, so I can discuss the fungal culture would probably be like the ideal one that I would recommend. It may take some time, even up to a month for certain colonies to grow. There's different media on which they grow. One of them is called the dermatophyte test medium, or DTM. That's the one that I will tell owners, like, that's the one we should do to rule it out. There's also, and I've never known this even from back in vet school, Silberod's dextrose agar.
Oh.
So anyway, they different.
I think I had that for dinner the other day.
Yeah. With your salmon, right?
Yeah.
It pairs well with a nice Chardonnay.
Hey, don't hate me for my lifestyle.
I don't, no. Yeah, but I mean, so those are kind of the cultures.
Is that something you do in-house, or is it something you send out?
It can be done in-house. I always recommend that we send it out to a lab, just because there are possibilities for false negatives, and it's the thing, you kind of leave it at room temperature in a locked drawer. I'm sure you may have seen this in practice too. And you wait a month and there's still no growth, which doesn't really rule out a negative results, unfortunately. The other things that we can do would be one of my favorites, which is a very simple one in-house, called a woods lamp. And so it's kind of the UV light that we shine,
Black light.
The black light, exactly, onto affected area of the skin. And usually what I learned in vet school, and there's different statistics out there, I don't know if anyone actually knows, but I've learned that 50% of the time it works every time. And so,
Colt 45.
But the thing is, only the Microsporum canis, M. canis, will fluoresce like green, yellow under the black light. But M. gypsium or trichophyton, we got wrecked the other day, it won't fluoresce. So, there are a couple, I would say the vast majority of ringworm cases in dogs and cats is from M. canis. And so, generally speaking, if you get positive fluorescence, then you can kind of establish a diagnosis of ringworm.
And what percentage would you say the woods lamp would work on if there is a, you think there's a ringworm case, you bust out the woods lamp and put it on there? How often do you get a positive from that?
Very rarely, honestly. Very rarely.
So the culture is probably the best.
I would say the culture
kind
is
of
the
gold
best.
standard.
And occasionally, and you can do slides to send out for a cytology review that can kind of show the macroconidia, and that would be a way to also distinguish between species of ringworm. But I would definitely go for the fungal culture on the DTM, which is kind of cool because there were times back in vet school and back when in other previous practices I was at before the village vet, where it's a little bit more cost effective to do in-house versus send to a lab, and you can sometimes get growth on the medium, and it's cool because it turns red, which is kind of fun.
Yeah, that's like the little tube or something that's you unscrew the top.
Exactly. You just pluck a couple hairs in the affected area, put it in, and wait. And it may take a week. It may take 2. There's no one. It depends on kind of where from the period of time that the patient had come into contact with the original infection. It usually may take 2 weeks, 3 weeks for any symptoms to be seen. And depending on when during the course of infection it's caught, it may dictate, when it could grow on the medium.
Right, exactly. So
Yeah.
if you've got a client that's maybe cost conscious and just wants to, throw the woods light on there, do a little in-house, or just say, hey, it's probably pyoderma, put them on some antibiotics. You put them on antibiotics, they go home, the dog doesn't get better.
Right.
Because you're not treating
right.
the problem, and then they come back.
Right.
That's another visit. And that's another thing. So pet insurance is very important. I would tell clients they would come in for orthopedic procedures or neurological procedures, and it would be $3,000 or $4,000, and they'd have to stroke that check, and people would always complain. And even in general practice, people would complain about how much it is. And I'm like, well, when you go to your doctor, you got your $40 copay or no copay or deductible, and you're done. Yeah. You don't see the hundreds of thousands of dollars that comes in on the backside of that.
That's true.
So yeah. I've had friends who have had surgeries that they say were $90,000, and they owed a few thousand for their deductible.
Right.
Whereas if you go in out of pocket, suddenly it's $20,000. You're like, wait a minute, why are we bilking the insurance companies?
It's true. It's very true.
Hey, if you like this video on ringworm, don't forget to like and subscribe to the channel and share it with all your animal-loving friends. My name is Mike the Voice Monkey, and we will see you this week with Dr. Max on Ask Our Vet.